Thank you everyone for attending today's virtual open house for the Certificate in Global Tobacco Control. At this point, you should be able to see our screen with the first presentation slide. We will be starting here in just a few moments. Hello everyone. We'll go ahead and get started on today's virtual open house. My name is Kelly Curtis, and I'm one of the admissions officers here in the department. Dr. Ryan David Kennedy will be presenting today. Ryan, I'll go ahead and let you share a little bit about your background.
Sure, I'm Ryan. I am faculty at Hopkins in the Department of Health, Behavior, and Society, and I'm based at the Institute for Global Tobacco Control. I'm a tobacco control researcher. I did postdoctoral training at the Center for Global Tobacco Control at the Harvard School of Public Health. I trained in my PhD in tobacco policy evaluation. And before entering a life of academia, I worked at a local health unit in Canada where tobacco control was one of the corners that I worked in.
Thank you, Ryan. So today's agenda will include a brief introduction on tobacco control. Program details will be covered. We'll touch on the curriculum. We'll give you a great idea of what online learning looks like here at Johns Hopkins University with our over 20 years of online experience. Faculty will be introduced. I'll cover the application process, scholarships, and financial aid, as well as the admission requirements. We will save some time at the end for questions and answers. If you have questions throughout the presentation, please type them in the question and answer box. We look forward to getting your questions answered at that time.
Is this over to me then?
It's over to you, Ryan.
All right, I'm ready. I'm so excited. So yeah, this is where I'm comfortable talking about tobacco control. So I think often when we talk about tobacco control in the context of public health, sometimes it's upheld as a corner where we've done great things. You know, we've accomplished so much in terms of reducing tobacco use prevalence. And sometimes tobacco control is sort of presented in the broader field of public health as a success story, and even suggestive that we're maybe done and over, and we can wash our hands of that and move on. But the reality is tobacco use continues to be, unfortunately, the leading cause of preventable death and disease, both in the United States and internationally. The projections, when we run the numbers, the number of people that are to be killed by tobacco use or exposure to tobacco smoke pollution like secondhand smoke, we're looking at numbers now exceeding 1 billion people during the 21st century. And this area of public health is different than other dimensions of concern, because what's driving a lot of this, of course, is an industry. The tobacco industry is remarkably well resourced and is constantly innovating and developing new products that present new challenges in the landscape of tobacco control. We also are different in some ways in public health because we have the benefit of a global treaty, the only treaty ever negotiated under the auspices of the World Health Organization. The WHO's Framework Convention on Tobacco Control is one of the most successful treaties in the history of the United Nations. It's been ratified by over 180 different countries, and it really gives us a roadmap in terms of what we need to do to address this global epidemic. The science of what we call tobacco regulatory science is a super exciting and interesting field. And we have the benefit of decades of research to build upon it. And within the certificate in global tobacco control, we draw on all of these different areas, what we've learned from the past in tobacco control building up to this moment, using the Framework Convention on Tobacco Control as a guiding sort of roadmap for what we need to be doing, and this new and emerging and evolving field of tobacco regulatory science. We can go ahead. Do I advance it? I'm sorry. Right. So who do we typically have engaged in our certificate program or certificate in global tobacco control? They tend to be folks that are working in public health and tobacco control, early to mid-career, professionals that have some area of influence in terms of what they're working on and how they can be influencing tobacco control policies in their environment. The skills that we know are needed to be really effective in this area include specifics around quantitative and qualitative skills. We know that to be effective in governance, whether it's in a government setting or civil society, communication is critical. Leadership skills, systems thinking, these are areas that we touch on in our certificate program. We've listed some of the job titles here that we've had in the past. Of course, it's just a sort of sample, but we certainly get folks that are social scientists, some that are more bench science, certainly, depending on the area of tobacco control, especially with the emergence of some of the World Health Organization's labs that are available to do more of the tobacco product testing. People are sometimes from traditional corners of public health, like epidemiologists or biostatisticians, behavioral scientists, and people that are in leadership roles in government or civil society. Next slide. So our certificate is 1 year. It's like slightly less than 1 year, I guess. People that enroll in this is a part-time program. It's entirely online. It's therefore has all the benefits and flexibility that come with something like that. The number of credits that people complete to earn the certificate are 25 credits. At Hopkins, we have terms, which is not super common in academia. So we have 4 terms. The first and second term are in Maryland's sort of starts in our early fall, September to October, and then second term is November to December. We tend to get a break in January. We have what's called a winter session, and then we jump right back into third term, sometime end of January. And fourth term just started today. Today is the first day of fourth term. So that gives you an idea of the calendar. Within each of those terms, students in the certificate take 2 classes. And they range in the number of credits, but your credit count was probably in the 5 to 6 credits. Well, it has to add up to 25, so you can figure it out, but it's fairly evenly distributed across the terms. The approach or the pedagogy, we are very much oriented around um, uh, the benefits of creating peer learning, group learning. We do, in some courses, peer assessments or individual assessments. It's very applied in its orientation. So most things that are taught are, the approach is to build skills within the students taking these courses. So there's a lot of real life examples, hands-on learning. And so, for example, in the course that I work on, we're looking at news reports in real time. We're looking at industry patents that have been published and accessible. I know Steve Tamplin uses current case studies and and every step of the way, you're working really closely with both an instructor in the course. Courses tend to have a teaching assistant too for better ratio and access to support. And the cohort that you'll be entering into, it's a really collegial environment. We do a lot to foster sort of learning between and across expertise within the student group. So the goal, if we were to sort of try and synthesize what we're delivering in this certificate, it's, you know, a formal education um, to research scientists and public health professionals that equip them with the necessary skills to develop and effectively communicate the evidence that is required to support effective tobacco control. And that's policy development and implementation. So sometimes we get one of those right. We might get a good policy in the books, but we also in the course have a whole course that's delivered on policy implementation as well. Next slide. And so this is, if you've been poking around online, you've maybe seen this a little bit too. This gives you an idea of the different courses offered by each term and their the titles of the courses that you're going through. But we have everything delivered online. And so prior to doing any of the online learning, there's actually a course that supports you in this area called Introduction to Online Learning. And it orients you to the platform and format that we'll be delivering so the students feel very comfortable in navigating that online environment so that they can get the most out of that format and platform as they go through the courses. There is some standard training that you would see in any graduate level environment specific to academic and research ethics. This is fantastic for people going into a program like this where they might have an interest in building their research future as well. So knowing and understanding some of the mechanisms behind institutional review boards, what and how ethics review and oversight is conducted, giving you the fluency and terminology in that area as well that's translatable to any area of research, but will be supportive of what you're doing in the course here as well. And then we have sort of, you can think of them as specific classes. And there's a lot of logic in terms of the sequencing of when they're introduced and how certain skills will build and grow as you go through. But in the first term, we have tobacco prevention and control and strategic communication classes. The there's a real focus on getting a understanding of the history of tobacco control globally, and then building up some specific strengths and concentrations in leadership. I teach the tobacco regulatory science, and we'll take a deeper look at that course as well. But that's really trying to understand tobacco from the perspective of the product and how regulations can be used to regulate specific dimensions of different tobacco products. When we think about emerging products like e-cigarettes or heated tobacco products, what sort of considerations from a regulatory perspective can be applied? We've certainly seen around the world strategies that limit nicotine concentration, for example. There are traditional applications of policies or regulations from other forms of tobacco, like age of purchase, marketing restrictions. what and how flavors can be used in these products. This course really does a dive onto some of those. And of course, because the orientation to this certificate is global, the types of products that we're talking about and learning about will cover a really broad example from around the world. Leadership in tobacco control, this is the one Steve Tamplin teaches, and students love its practicality, and the assessments are very interesting as well in terms of sort of reflective essays and things like that. The quantitative methods in tobacco control, this is one that sometimes students are a little anxious and nervous about because uh, a lot of us had rough experiences with statistics, for example. This is one of those fantastic opportunities. Kevin Walding teaches this class and really get students through a project from beginning to end. And the teaching assistant there is also wonderful. And I think it does a lot to help students know and be able to use data, but also to interpret data in the context of their work environment, to be better at their job and better at being able to translate academic and scientific findings so that they can be better understood by decision makers in their own contexts. We've got a professional development workshop, which is again sort of on the side of those skills that are required to be effective in influencing tobacco regulatory advances. We have a qualitative course, which is fantastic. Lauren Slabicki teaches that. A lot of students have never done any qualitative skills, and so this is a fantastic entry level, but very quickly will build up competencies and skills for students in this area as well. Qualitative skills being really relevant to better understand situations, to help inform campaigns, to better design quantitative surveys. And then I was saying earlier, we often in tobacco control do a great job of enacting policy, but we need to really focus on implementation, especially in lower resource environments where we need to be really prudent and creative in what and how we approach things. Connie Ho teaches that class, and she is fantastic. We can go to the next slide. I could talk all day about each of the courses and how great they are. Okay, so you heard earlier, Hopkins has a really strong depth of experience, deep experience in online teaching. And some of the instructors in our course, like Fran Stimlin, I feel like Fran has been a real pioneer in this area. Many of us that are doing this online teaching have been part of the Hopkins-wide experience to improve our online teaching. We are very adept at the different sort of pedagogies that can be deployed, the use of technology, the use of the platforms, and that is all very apparent in the evaluations of the courses that we have. I want to just take a step back and say that all the courses we deliver here, these are graduate level courses at Hopkins. And as such, they have been reviewed by our academic standards. They've all been approved as graduate level. And in that vein, they are rigorous. They are of a standard that you would expect from Hopkins. And they do require significant effort on the part of the students to complete them. The systems and networks that are in place, as you'd expect, we have tremendous support, whether it be technical IT support from different departments or different parts of the School of Public Health. We have an entire office, the Center for Teaching and Learning, that helps us support our lecture designs. And I'll show you one of the course sites in a moment, but we really have thought through the delivery of the content in terms of what is best done, sort of what is best delivered through didactic lectures, what is best, what and how to best teach through assignments, what is best done collectively in what we call live talks. So those are sessions that are synchronous. Students come online and they participate with, it's just like what we're doing right now in a Zoom call situation. People zoom into the presentation, and that time is spent together, either collectively thinking through a problem, or students presenting information across to their peers, really making the most of this online platform to structure the learning in ways that optimize efficiency for the student as well as educational experiences. Next slide. So Course Plus is the platform we use, and we often refer to Course Plus as if everyone knows what it is. It's basically a website that is managed by Johns Hopkins, and it's where we would have all of our course material. And it's very well organized. You're introduced to that in the online learning program. It sort of functions as a way to send emails across to your classmates. It serves as a library. It's a repository of all the readings that you'll have. And it's almost like a calendar as well. It'll have a week by week outline of what you need to do. Is this where I share my screen?
Yes, if you want to, Ryan, please do.
Okay. Hold on. We're going to Course Plus. Okay, so people can see my Welcome to Tobacco Regulatory Science page. We often hear in these open houses that students really want to get a sense of the feel for what it's like to be a student in one of these certificate courses. And so this is the landing page for my second term course that I teach called Tobacco Regulatory Science. And I'm in the overview page right now. And you can see, it has a welcome, and it has sort of a highlight of recent communications. This is what we call the content page. And this is where I was saying it's a little bit like a calendar. And so we can see it's organized by weeks. So there's 4 terms. So each term is 8 weeks long. And this, we start with week 1, and you can see on week 1, this was this past academic offering. So it started October 26th. There was a live talk. And this was your page and you were the student, you would probably have an active link there that you can click on the live talk when it's time, and it will take you to the Zoom page, and you would log in and participate in the live talk. It also has all the lectures outlined. So you can see here, we've got 3 lectures. So in week 1 of my class, you have 3 lectures to get through. The first one is an introductory lecture that I give. And then I give one on the Framework Convention on Tobacco Control, specifically Articles 9 and 10 of the Global Treaty that deal with tobacco product regulation. And then we have a guest lecture from Matt Holman, and people that are familiar with tobacco regulations will know he's at the FDA. He's the head of the Center for Tobacco Product. He gives a lecture on what and how the Food and Drug Administration in the US and the Center for Tobacco Products, their processes in regulating tobacco. So it's a good example there. We can also list when there's deadlines. So for this one, I had a deadline for watching the live talk. We know and understand that maybe students can't always participate in synchronous classes, but they are recorded typically and available. Different professors or instructors will have different expectations for what and how students engage with the class. But the orientation is always to support students. You can see here we have, in week 2, again, further another live talk, lectures 4, 5, 6, and 7. Some of these are more oriented around specific products. So we have a lecture specific to e-cigarettes. We have one on water pipe and one on smokeless. Sometimes we have optional videos that we ask folks to watch as well. We have included in the Course Plus the resources. I can show you the online library for an example. And so we've done, you don't need to go to a physical library. Everything will be here for you to be able to download. The links are always updated and checked so that students can have a very streamlined experience when going through the required work. and things like textbooks as well. We have library agreements where you can get the chapters that you might need, the PDFs of the academic articles that you might be asked to be reading that week. When you have assignments that are due, you would just go into the Course Plus website and you can click through a Dropbox and upload your documents. And similarly, when your instructor or teaching assistant has reviewed your assignments, they will be able to provide written comment back to you, and you can pick it up on the Dropbox as well. There's functionality for emailing the whole class. The instructors typically do a weekly email reminding you of what assignments might be due that week. I always do a summary of what the lecture material is going to entail, and sort of the high points that I want students to gather or take away from that week's lecture as well. So hopefully that's a bit of like that demystifies some aspects of the Course Plus website. I think it's a fantastic way for students to both consume the lecture material, but also to engage with the instructors and the guest lecturers too that sometimes come in to the class. Do we need to go back to the slides then? I'll say that as well as instructors, we're a small group and we meet regularly across the certificate program.
Oh my God.
You'll do it, you'll find it. I'll maybe take a moment here to also introduce my colleague, Carla Clemens, as there she is. She's someone that students often get to interact with a lot through the certificate program. It's like, I don't know what your title formally is, Carla, but basically any student that needs anything is welcome to reach out to you, and you help them navigate and problem solve or connect with faculty instructors. Also, you're able to support applications online when people are submitting things. And generally, if people have specific questions about the content too, Carla is a really good resource there as well. I think, and I know we have some people online, and I mean, we've mostly covered the content of the certificate, who would be taking it ideally, some of the approaches that we take as instructors and in our online formats. I'm happy to take any questions at this point if people have specific inquiries or anything. People are welcome to put things in the Q&A section, or I don't know if people are able to unmute or not.
Ryan, they will be typing in their
Okay.
questions in the Q&A box. Do you see the next slide on faculty?
No.
Um,
So when you click share screen at the bottom, the green arrow up.
I think you need to give me back control. Because I can change the slides, but I don't think that's being viewed. And I can advance the slides, but I don't think that that's being shown.
Right. You can also email me the slides and I can put them up as well, if that's easy.
Yeah, let me do that.
Would I be able to see questions if they came in?
That is a good question. One moment.
I'll say year to year, our cohort size has been a little bit up and down, but we're roughly around 15 people. So it's not like you're coming into a class with 400 students and there's never an opportunity. I think the cohorts we've had have been, I mean, we're always welcome to include more students, of course, and the online format is easy, relatively easy to scale in a sense that it's not like we run out of room in a classroom. But the experience generally has been great for students to get to know each other. I feel like at the end of the 8 weeks too, because it's fairly not intense, but there's, if you're doing a course like mine that's 4 credits, you can think of it roughly as about 4 hours of what we call contact hours. So that might be a 1-hour live talk and then 3 hours of lecture that you would have. Then there's assignment work to do, which might be an additional 1 to 5 hours per week for things like that. In my course, we have readings, and the readings are sometimes recommended. For my assessments, when I'm doing tests, for example, that cover the content, I don't tend to require the readings to be integrated there. The courses tend to really have the orientation that the learning is in the doing. And so we do a lot of practical assignments, and this is sort of typical of any OPAL offering. The idea is to create and deliver content that students can work through, and then have the sort of support from their instructors, and or, oh, we're getting some questions. I can see the questions coming in. So
Yeah, you should be able to advance the slides. Can you advance the slides?
I don't even see the slides.
I was going to try to email those to you, but let me pull up the slides again.
So there is, Wasim had a question, and Carla looks like she's typing in. Thank you. Okay, that's a very specific question to Wasim, so I'll leave that. Oh, I can see them now.
All right, let's get to, I'm going to go through. Getting us back to where we left off. So this is the next slide after you shared the
Right.
the classroom.
Yeah, I've mentioned some of the faculty sort of in passing as we were going through some of the courses. Joanna Cohen is the director of the Institute for Global Tobacco Control, and people that work in this area of public health probably know Joanna. She's one of the senior editors at our journal Tobacco Control. She's been at the Institute for Global Tobacco Control at Hopkins for almost 10 years now, I think, and is a world expert in this area. And she provides leadership for the certificate. I'm one of the faculty. Lauren Zablicki is a scientist with the Institute as well, so I work really closely with Lauren. She teaches the qualitative work. Fran Stillman is one of the one of Hopkins, leading experts in online teaching. She really has perfected this medium, and she has decades of experience working in this area. So she's someone that's great to know and meet, and then she has access to whole networks of people as well. Steve Tamplin has been at the Institute for probably close to 15 years now too, but had a career previously at the World Health Organization. And so again, has a very interesting perspective on governance and tobacco regulation. Kevin Walding is an economist by training, and he teaches the quantitative course. And he is the associate director at the Institute for Global Tobacco Control. He advises the World Health Organization on different dimensions of tobacco control, including illicit trade and specific packaging. Connie, like I said, is an implementation science expert, and just wonderful colleague, and she's had experience with IGTC too. She's in the Department of International Health at Hopkins, and sort of gives you an insight into some of that world, and she co-teaches with Nazreen the implementation course. And so the Institute for Global Tobacco Control, it's almost all of us are directly or associated or affiliated faculty. IGTC is a World Health Organization collaborating partner. Carly, you probably remember the terminology a little bit better than us, but we all work under the Bloomberg Initiative to Reduce Tobacco Use, and the partners include the WHO, the CDC foundations that do the Global Adult Tobacco Use Survey, our colleagues at Campaign for Tobacco-Free Kids, the union, Vital Strategies. We also work with the University of Illinois in Chicago, IHME, which is the Institute for Health Metrics and Evaluation at the University of Washington in Seattle. These groups often are represented in some of the lectures with guest lecturers. We can go to the next slide.
So the next slide is admission requirements, which I can cover. I just wanted to thank you, Ryan, for sharing the need for these skill sets in global tobacco control and the details of the program. I hope that was helpful for everyone to kind of see the quality of the program that is offered. So applications, the deadline to submit your application is July 1st. For the start date of August 30th. We have one start date a year. We use an outside application portal called Sophus Express, where students will upload all their application documents, complete sections in the Sophus Express portal. We require a bachelor's degree from an accredited college or university. Unofficial transcripts need to be uploaded into Sophus Express from each university attended. You upload a current resume or CV. You'll request 3 letters of recommendation in Sophus Express, and your recommenders will send those directly back into Sophus Express. At least one of those needs to speak about your impact or your role in tobacco control. For our international students, you may need to demonstrate a proficiency in English. And for international applicants, a course-by-course evaluation is required, and we do recommend using WES or World Education Service. So the tuition for the upcoming fall term is $1,233 per credit hour. The Opal Scholarship of $474 per credit hour is applied to that $1,233, and it is available to all accepted students, so there's no additional application steps required to receive this partial Opal Scholarship. With 25 credits in this program, your current investment would be $18,975. Because what you're doing is after the partial Opal Scholarship is applied, your cost is now $759 per credit hour. So if you do 759 times 25, that's how you'll come up with $18,975. Students pay for the credits or the courses as they take them in each 8-week term. So payment is not due for the entire amount. It is paid as you go, as you take those credits or courses. The application requires, for the scholarship application, it does require submitting 3 short essay questions. There is an IGTC scholarship. It's full tuition coverage for applicants from low and middle income countries. The deadline for that IGTC scholarship was January 15th of this year. So that deadline has passed. They will reopen the application portal the end of September, and we'll start taking applications for fall of 2022, including the IGTC scholarship applicants. We do have a financial aid office for those that want to explore federal and private loan processing. And so if you are, thinking about moving forward with the application steps, if you have additional program questions, we are certainly here to help with that. So now we're going to open up for questions. I'll cover more of the admission type of questions, and Ryan will cover program questions. We'll try to address all the questions. Some of the questions, though, may be better answered by directly reaching out to you. Ryan, are you taking a look at the questions?
Yeah. We've got a couple of questions about the scholarship. So we did describe that the deadline, it opens around September, and we need to have things in by January typically. It's not an onerous application. Like we said, you need to be residing in a low or middle income country, and we use the World Bank definitions for those jurisdictions. The short essay answers essentially ask you to characterize your current work in tobacco control. We want to have a sense of where you are, what stage of career, what or how this certificate will help not just benefit your own career, but how it will benefit tobacco control within the jurisdictions that you're working in. It's not like some graduate school applications where it's pages and pages and tricky to navigate. And Carla, do people email you for applications, or those are sent out? People can download the forms to complete?
So it would go through the same SOFIS application portal is where you would then complete the additional questions needed for scholarship.
Right.
Yeah. And for those that are interested in applying, I work with a team here, so we are very supportive of helping you navigate through the SOFIS Express application portal. We have support emails as far as how to complete the additional steps. So definitely use the support that we provide on program questions that you may have, on application questions. You have a high level support really throughout the application process and all the way through graduation. A common question that students ask is time commitment in taking 2 classes in each 8-week term.
Okay, so per credit, it's roughly an hour, as I said. And so if you've got a 4-credit class and a 2-credit class, you can expect about 6 hours of lecture content. So some of that might be online lectures, an hour live talk that you might attend would count sort of towards that. And so Carla, what's the rough? We tell people like 15 to 20 hours a week or something commitment?
Yeah, so we say at least 18 hours a week to commit with all
Right.
the reading and the lecture, and yeah.
Yeah, Wasim does have their hand up. I don't know if, Wasim, we saw that you asked a question, and I assume that you've already applied to the program. And so Carla's responded to that in the chat.
Do you see this other question as well? It says, I am from Bangladesh and currently doing my master's in the US. So I think they're asking, would they qualify for the IGTC scholarship?
Carla, I think so. If you're from an LMIC and you're working on an LMIC.
Yeah, so, and then also depending too on, so if you're currently, and then are you staying in Bangladesh? Are you not residing in the US after the master's also too would determine the eligibility.
Yeah. Another question that often comes up from students is if they're not able to complete this in 1 year, what's the flexibility of that?
I can help answer this question because I know sometimes there's unforeseen external circumstances. So we just very much ask that you stay in communication with your instructors proactively from the beginning if you're experiencing an issue. It really is recommended to be completed under a year, but if there is some sort of like health emergency or something along those lines, if it's communicated, there is an option to be able to complete it at the next year, but that would need to be decided between you and the instructors, if that helps to answer the question.
Yeah, so it sounds like it's a case-by-case basis.
Correct, yeah.
Because the certificate is structured too with like set courses that are offered in set terms, it's not like you can skip term 3 and then pick it up in term 1, you would have to wait for an entire other cycle. So Wasim is asking about live talks. Like the students that participate in this, the majority of our students are spread out throughout the world. Instructors have strategies for when they have their live talks. I have them early in the morning in Baltimore time, which tends to be later in the evening for students in Asia. It's very early for some of our students in South America. It's, you know, there's never a perfect time, but in the years that I've been teaching this, that has been successful for everyone. Now, people sometimes miss it for various reasons, and my live talks are always recorded, and I ask the people watch them within a week of when they were offered. And so part of my assessment is participation in live talks, so I do expect people to watch them, but there's consideration for time zones, of course, when we're doing this.
Yeah, thanks for clarifying that. And I think that there was a mention of the IOL, the Introduction to Online Learning course. Yeah, there are, for the Introduction to Online Learning course, that's required before students start the class. So students feel comfortable with Course Plus. How do you navigate? How do you drop an assignment? And there are modules that are self-paced to complete. There is one live talk session that you have to select. So there are times to choose from. I know that may not be ideal for everyone, depending on where they're located, but that I think it would be about the only time that would be a challenge as far as the live talks. It sounds like once you're in the program that that the live talks are presented in a way that it meets most people's requirements.
Yeah, and we consider who we have in the cohort and where people are calling in from. So it's yeah.
Any other information that either one of you guys could think to share with students that often come up in working with students throughout the program?
I think students have a positive experience because of the practical nature of what we're doing. I think sometimes we have students that have work assignments that they're often able to integrate into some of their coursework, which we are open to. Of course, it's the objective to ensure that students are learning what they need to learn to make a real difference in the world of tobacco control.
Mm-hmm.
So I think also, like, Carla's been doing a lot recently to build up, because we've had several cohorts go through the certificate now, we're getting a bit of a sort of sizable alumni. And so there's been work and effort in building better networks so that people can connect with students that even weren't in their year, but have gone through the program. And so we're doing our best to expand that. Because when you come to Hopkins, you not only get access to the instructors and your classmates, but you get access to the alumni as well. And so I think that's something to keep in mind in terms of what the value is of this sort of engagement and the time that people put in. We've done it how many times, Carla, in this format on the Opal? 3. This is our 4th cohort?
This will be the third.
This is okay.
Third cohort.
Yeah, for this particular program. And I'm with students along with my the members of the mission team to about when class starts, and then we have somebody that picks up that has the bandwidth for any kind of registration questions. I do hear back from students, and the things that I hear are just the quality of the program, the connections that they're making, not only with the professors, but also with your fellow classmates. So it is a very, interactive curriculum, interactive program, has very much a classroom feel.
I'll just add on, Kelly, to what you just said. I'll be one of the people that, as you go through to the application process, and then even helping you with making sure you're registering for the right courses each term, I'll be your contact and support for that. So.
Yep. So any other closing comments? I think we've addressed all the questions.
I think if you have specifics, like, you can reach out to Carla in terms of timing, but in terms of if folks that are online are from LMICs and are interested in this course and the scholarship opportunities there, you've been shared the timing that typically happens there. If people are not bound by that route, admissions are still open. So the lines of communication are open too. So we're happy to answer any questions that might come up later as well.
Yeah, please do reach back out to us. You can see the numbers on the last screen. We're here to, again, get your questions answered on the program, the application steps. Thank you, Carla. Thank you, Ryan. Everyone have a great rest of your day.
Thanks.